internal problem in abdomen. So the purpose is to look for any abnormalities and presence of the hernia. So look for the different abdomen. So sounds any source of pain. So the equipment are stethoscope, tape measure, small pillow. So the consideration before, during, and after the procedure is to explain the procedure to your client and provide privacy for the client. So, the things to document after the procedure: document all necessary findings, and then during the assessment. So,
place the client in supine position with the head of the knee supported with a small pillow or folded sheet of drapes positioned accordingly. It is allowed to relax an abdominal wall musculature. Examine the abdomen in order: inspection, auscultation, percussion, and palpation. These two abnormalities detected or inspection provide clues to inter-abdominal pathology, which are further investing and palpation. Inspect the abdomen for size, symmetry, and contour. Observe the condition of the skin and skin color, hair distribution, and any presence of lesion, scars, striae, and superficial veins. Please do note the any abnormalities, taking note of the surgical scars, which should be correlated with the percussion operation, encouraged, and vein. Note for the position, contour, and color of the obliquus. There should not be any signs of tenderness and discoloration. Ask the client to raise his head without using the arm for support. This to consent any bulges of hernia. If this tension is present, measure the girth and obliquus with a tape measure, noting for the generated or localized distinction. Auscultate the abdomen for bowel sounds using the diaphragm of the stethoscope. It should be applied on the abdominal wall with firm but gentle pressure. Light for bowel sounds for 3 to 5 minutes. This to prepare presence of abscesses for bowel sounds. Place the warm diaphragm in each of the 4 quadrants of the abdomen. This to determine the presence of abscesses of bowels. Use the belt of the stethoscope over the arterial, renal, and iliac arteries to listen for the bruits. Bruits of whining and sound heard over the major contours and during syntaglas, commonly systole and distole. Work out the several areas in each of the 4 quadrants. Use a systematic pattern. Begin in the lower right quadrant, proceed to the upper quadrant and upper left quadrant and lower left quadrant. This to determine the presence of tympani and sound in the casting and stomach and test lines and dull. Palpate the abdomen over all 4 quadrants. Begin with the light palpation, then do the palpation to palpate organs or any masses. It gives some ideas as to areas and masses or tenderness. For light palpation, press your palm arm only about 1 to 2 cm and rotating motion, and note is there slight tenderness or superficial pain, large masses, or muscle contouring. This to note the presence of location of any abdominal pain of paint the area of single pain. For deep palpation, use the binomial method and depress the abdominal wall about 4 to cm. It may be helpful if evaluating as master an upper part of the pressure while the lower head used to Open the lever, place your right hand at the midvicular line under the 11th or 12th rib, place your left under the client back at the lower ribs and press upward. This to be able to properly locate the liver and to be able to check for any tenderness of abnormality. Ask the client to inhale and exhale deeply while pressing in up, nothing for any enlargement or mass. Document the procedure done by finding to ensure the continuity of care.